Carl, this is Helen.
Hi, Helen.
I received an email that I just forwarded to you from Howard Deshefsky that he cannot attend. He has a doctor's appointment today.
Oh, okay.
I also received an email from Nordia who says
Yep.
she is in between meetings, so she will be on, but not as active as she would like. And
Yeah,
she says she emailed you a few minutes ago about that.
she did. I also got emails that Brenda McEwen and
I
Patricia.
was able to come after all, Carl. I'm here. I just don't have a
Oh.
camera today.
Oh, okay. That's why I can't see you. Okay. Hi.
And Helen, my husband Jim McEwen says hello.
Hi, Jim. We go way back.
I know.
Patricia Graham will not be here today.
I see that Kadzo's on and Nordia is on.
Okay, I think we're ready to begin then.
I think you're waiting for Jonathan Merritt
Is
gonna
Jonathan
join?
here?
Not yet. Here's Chris.
I think Jonathan's the only one.
So you have Kadzo, Brenda, Carl, Nordia, Bob. Is Patricia Graham gonna join?
No, she's not able to
Okay.
join tonight.
All right.
Okay. Is Jonathan with us or? Okay. Well, could we have someone volunteer to take minutes until he joins us?
I'll take some notes and forward them over to him. He should be here. We talked about it this afternoon. I'm surprised he's not on. Maybe he's having internet.
Oh, okay. Great. I'm just going to read the required thing anyway, probably, and he'll be here. Good evening, everyone. This is the regular meeting of the West Hartford Prevention Council. The meeting will come to order. This is Carl Shields, Chair of the West Hartford Prevention Council. I'd like to welcome you to the virtual September 9th meeting of the council because in-person attendance of public meetings is likely to increase the risk of transmission of COVID-19. This meeting is being conducted in accordance with Governor Lamont's Executive Order Number 7B, which permits municipalities to conduct public meetings virtually. Commission members and some town staff are participating by WebEx, and members of the public can access this meeting by calling 1-408-418-9388 and using access code 132-947-8725. Because of the virtual format, there are some special rules and procedures that I need to cover before we begin. These are for all the commission meetings. First, I ask that all participants please mute your devices when you are not speaking. If you wish to be recognized, please raise your hand and I will call on you. If you are participating via audio only or I do not call on you and the debate is ending, please unmute your phone and let me know so that I can recognize you. Second, pursuant to Executive Order 7B, all speakers must state their name and title each time they speak. Third, because of the difficulty in tallying voice votes on a video conference, I will require that votes be taken by roll call. Fourth, I would like to describe how the hand-raising process will work. Unfortunately, our conference technology does not allow us to identify individual caller by name. So when the public comments portion of the meeting begins, which is near the very end, the moderator will randomly unmute one call in line at a time and ask everyone to state their name at the time. The voice that we hear will belong to the person whose line is unmuted. That person will then be recognized by the moderator and asked to restate their name and provide their street address. We will repeat this process until we have unmuted every phone line. It is very important that you state your name each time you are prompted by the moderator. If the moderator unmutes a phone line and does not hear a voice after the prompt, that phone line will be removed from the conference. I will now call the roll. Bob Macca.
Present.
I know Patricia is excused. Nordia. Hello. Jonathan. Oh, there you are, Jonathan. I see you. So I know you're here. I'm here. Brenda's not here. Howard's not here.
Brenda's
So-
here.
Oh, that's right. I'm sorry.
It's okay.
Sorry. I did it again. And Tadzo.
Present.
Thank you. Well, this is pretty cool because I can see everybody. I'm not sure I even have to take attendance, but whatever. Okay. The first order of business. Oh, maybe I could just welcome Megan Westcott. Is she here, Helen?
Yes, she is.
I'm here. Thank you.
Okay.
Hello, everybody.
I
And
believe Helen Drohan wanted to say a few words and she's on mute, so she'll have to unmute herself.
okay, Helen?
Helen Drohan, Public Health Nurse for the West Hartford Bloomfield Health District. And it's my honor and my privilege to introduce Megan Westcott, who is an epidemiologist for the West Hartford Bloomfield Health District. She's been working with us now for about a year, and she received her MPH in epidemiology from Tulane in 2020, and has been, like I said, working with us after working an internship with us for a year in summer of 2019. So she's been a wonderful asset to us as an epidemiologist, helping us with all the data and taking care of all the COVID issues in the health district, which has been really quite helpful to us in doing all the stats and all the numbers. She also teaches an undergraduate health promotion course at the University of Hartford. So I want to say to everybody, welcome Megan to the program and to this committee.
Welcome.
Thank you.
Welcome, Megan.
Thank you. Thank you, Helen, for the introduction. I'm looking forward to getting to know you all and working with you closer this year.
Thank you. I want to also just officially thank Helen for all her participation and contributions to the council for a number of years and how valuable and beneficial that's been to so many residents of the city of West Hartford and Bloomfield. Thank you, Helen.
You're very welcome. Thank you.
We could move on to the minutes of the meeting of June 10th, which was our last meeting. I know they went out quite a while ago. Jonathan is very quick about that. So are there any changes or amendments? I understand that we can do a voice vote on these now. So all in favor, say aye. Aye.
Aye.
Hi.
Okay. Anyone have any opposed? Okay, minutes are approved as unanimous. Thank you. Next order of business under old business is Town Council appointed West Hartford Prevention Council versus Amplify Required Coalition, the West Hartford Prevention Partnership. We've been here before, folks, so let's get the latest update from Helen.
Good evening, everyone. I know there's been some confusion and some discussion back and forth about this term called Local Prevention Council. And Amplify is a state organization that provides funding for various topics that are related to substance abuse and mental health. And they require municipalities who receive the funding to have a local prevention council. Local prevention councils look a lot like this group, but they are action oriented, and they are by volunteer, right? So people volunteer to be on it. Anyone can be on it. Anyone that's interested in supporting topics that are related to substance use and mental health and wellness. The town council appoints the West Hartford Prevention Council. That is this body. And this body's mission is to provide advice to the town council and to be a vehicle for people to express concerns about issues related to substance abuse and prevention and wellness and mental health to the town council. And so by virtue of the fact that you were appointed, really, it's a separate body and has a slightly different mission from what a coalition looks like. And a couple of years ago, we had a coalition, and it was called the West Hartford Prevention Partnership. And after much discussion over the summer between Astrid and her staff and me and Carl, we figured we would recommend that we have a separate coalition that would do the work of the grant implementation and actions that may be of interest to the community as well as to this body itself. And so we've we make that recommendation, and there are some discussions that will take place this evening that will touch on actions as well as on what this body, the West Hartford Prevention Council, does. So, for example, we will add under staff, I think instead of staff reports, we're calling them standing reports. Under standing reports, at your October meeting, we will add a letter F, and that will be the coalition report, so that you can hear if what the coalition might be working on. You're all welcome to join the coalition. You're all welcome to participate in the coalition to whatever degree your schedule allows. But you are appointed to be on this commission and to attend these meetings for sure. So if that isn't, I hope that that's more clear. But if you have questions about it, certainly we can take some time to answer those either offline or this evening. In a few minutes, you're going to hear about some coalition building training that Astrid is going to discuss. And that is related to, again, that coalition, the Amplify Required coalition. And then you'll also hear about some other ideas that might be action oriented. So what your job as the town council appointed prevention council is really to hear and know about those activities, to endorse them, to support them, to help publicize them, to participate in them to whatever degree works for you. But it's mostly this body isn't necessarily an action oriented body. You have terms, and at some point, some of your terms might end in December, so it's a calendar year. So in November, we'll discuss reappointing you if there's an option for a reappointment, or there might be, other people who would want to join. I know we have at least one voting member that is vacant at this time, and then there's also 2 ex officio vacancies, and that's the students, the high school students. And I know Carl has been in touch with the Board of Education to see about making some of those appointments. So does anyone have any questions about these 2 bodies? There's the town council appointed, the commission council, that's you. There's this Amplify Required coalition, and that's going to be called the partnership. Seeing no questions, Carl, I will turn it back to you to, or maybe to Astrid, to introduce our new staff liaison and to thank our outgoing staff liaison. Astrid.
Okay. I just wanted to say one thing before we move on. I think this clarification is extraordinarily helpful, and will bring our roles and functions into much clearer relief. And thank you, Helen, for that very great description of what we should be doing versus a coalition of the community members. Okay, Astrid?
Good afternoon. Astrid Calderon, Manager of Social Services. Welcome everybody after a good vacation. Today, I would like to answer any questions about the explanation, if you will, if there's any questions or comments about this, but we're very excited that after many, many years of this body being the local prevention council, we will be able to define roles and also to be able to do actions. But tonight, I also would like to let everybody know that Jackie C. Edgar, who have been with us as the staff liaison, this will be the last meeting for her. Jackie was instrumental in making things happen. Basically, she carry on, on her, on her with her responsibilities, the complete, uh, basically, local prevention council grant from last year. Some of the actions that this group sponsor, such as a video, all of the actions from the grant, Jackie was instrumental in making things happen and having collaboration with other sectors of the community. Jackie will continue here at the Social Services Department as one of our clinicians. She also will continue in the Wheel of Prevention because she is the social worker assigned to be every week at the Hartford Community Court. This is for people that are arrested 18 and over in the town of Bloomfield and West Hartford. And that way she will be able to continue to assist those one who need mental health or substance abuse resources. Jackie will continue to be one of our again, social workers in our team. And I just wanted to say thank you for all the work that you did last year. And I also would like to introduce Miss Kelly Waterhouse. Kelly Waterhouse, she's an LCSW clinician that she was hired back in June. And she have multiple experiences, including the last one, which she came from the town of East Hartford, and she was a counselor for children, and she was working with families in many instances and helping them through the Juvenile Review Board and many other activities related to community and collaborations. Um, she's very good with youth, and also she is a QPR trainer. So Kelly, welcome. She's going to be our liaison. We can define and talk more about what's exactly the role of the liaison. But I just wanted to welcome you, and we will be around. Jackie and Kelly will continue to be in touch and make sure that there's continuity and that this change in staff is not impacting any of the work that it's being done. Thank you.
Thank you, Astrid, and welcome, Kelly. I know the liaison role is essential for this council in helping when we put together agendas and send out communications and receive notifications and want updates. So it's a very, very important role for me personally. So welcome. And I want to thank Jackie for what she's contributed, and spending last year's grant within pennies was remarkable. So good luck
You're
to you.
welcome.
Enjoy community court. It's fun.
I will. Thank you so much.
Okay. Can we talk about coalition building training?
So we are excited because now with clarity in the body of the group, we have the idea of, first of all, building the coalition, but also that coalition follow the Amplify Local Prevention guidelines. So we are going to start. Kelly will be the staff liaison, which is from here. She will be more in the coalition. For here, she also will be, doing the reports about the coalition. But Kelly will be helping us to build this coalition. Like Helen said, some of you guys that are more action oriented in this community and would like to participate in the coalition, it is a separate meeting. And we're going to include Ken Plower, who you guys know very well. He works at the prevention training and technical assistance services, and he will be a consultant into this building effort. We will use all the resources available for us, especially the ones that Amplify have. And I recently was able to participate in the National Prevention Conference with a grant, and I have plenty of materials that I would like to share. But we're very lucky. We're also going to follow the recommendations and follow the actions that the grant is suggesting. This year, the grant funding have increased to $12,000, and we would like to make sure that we are able to put together all of the actions related to the guidelines that the state is recommending, but also have a continuity on a task that we started, which is the community assessment. So all of the actions will go there, and Kelly will be working with us as well as other people. So any questions about coalition building? Quickly, there was a website created last time, the West Hartford Prevention Partnership. We're going to try to see if we can keep that website and that name. We're going to make it, and Jane Chenchel, we have been in touch with her. So we're going to see if that's a possibility so we can have some continuity on the work that it was done before. Okay.
Thank you, Astrid. It'll be a pleasure to work with Ken again. I would just remind folks that in terms of coalition building, in your wellness assessment report, there's a section on the strategic prevention framework, and that's foundational to coalition work. So if you want to do a little bit of reading, and it doesn't take long to read, maybe 20 minutes. Wellness assessment. I had tried to organize a retreat this summer, but it didn't work out, really just for a couple of reasons: to get to know council members better and to focus on the 10 major findings from the wellness assessment. As has been clarified, sometimes the community organization is involved in this, and there will be a lot of crossing over in the work. But since an assessment had never been done, this was an important piece of the work to have the coalition move forward. The findings about in mental health, about depression, suicidality, youth, about being increased risk, wanting screening and brief intervention, both in mental health and substance abuse arenas. There was a lot of crossing over about recommendations, both in the mental health and the substance abuse side of the report. And also quite a bit in terms of insufficient awareness of the community about what is available and how to access it, and not enough coordination. So they also thought that West Hartford was in a good place to do this work. And that was a very positive thing from that. But we will be talking more about this. And I today wrote up for myself a little summary of the findings, just to have them cemented in my head, because it's a 135-page report, and that's a lot to get through. But I think if I can just summarize the major finding slides in the report and distribute it to you folks, I'm going to do that. It will be helpful for you to think about our efforts, and then we can share that with the coalition group also. Okay.
Carl, this is
Yeah.
Helen Rubino Turco. I just wanted to thank you for your efforts to lead that wellness assessment so far, and also to have ideas about how to continue it in the coming year, and to dig deeper. There were some unfinished items, and as well as some updates that could be done this year with the help of a student perhaps that you're discussing with
Yes,
the health district about having a second student to oversee. And that would really, that action would be something that would be undertaken, as we've discussed, by the coalition, because it's an action item. But I just wanted to thank you for all your efforts that you did to put that study together, to oversee the two students, to gather all the information, and also to synthesize the information for us. And what was really clear to me was that it's not that we lack programs or services, but it's the communication between the providers as well as the communication to the people that need the help. They don't know where to turn. And
right.
and that, so that's something obviously that this Prevention Council would very much like to see, activities that would promote communication and
Mhm.
additional activities like that, I would think. So I wanted to thank you again. Thank you.
Thank you, Helen. I appreciate that. I have been contacted by UConn as to whether or not we'd be interested in having another MPH student. And Megan, I had contacted Amy about, because she's at MPH, but you and Amy may have a conversation, and one of you get back to me if you could tomorrow. Because of course they wanted this information last week. I've just typed up or written up today my summary of what I think those actions might be. And I'm going to be sending those to you, Helen and Astrid, and the staff there to look at and see what you think about it. Some of those missing pieces that you've identified, I think I caught, that will augment this report and continue the work moving forward in a productive fashion. Any questions about that or the wellness assessment elements? New business, marijuana legalization. Well, people know that a law passed that making possession a completely different matter in the eyes of the law, although all the details of the legislation have not yet been implemented. So we invited the police department, and weren't able to come tonight, but they should be able to come next month and talk to us some about the law pertaining to marijuana. There's a lot of issues, I think. Access for children and youth, the impact of that on their young developing brains in a learning environment, the multiple educational efforts this council may need to make and support, particularly with the community coalition, addiction, and also the piece of it that has a little attachment about the town can attach 2 or 3% to if there is a marijuana dispensary in town, and that money would be used for prevention efforts. That's a big deal. So those are kind of some of the major things and reasons why we want to talk about this. And I think Nordia may have brought it up last month or in June, quite a while ago anyway. So thank you for that. Any questions about that?
So Carl, this is Helen Rubino Turco. The intention is that we're going to table this item until the next meeting.
Yes, exactly. Yep.
But if anybody had any questions or wanted to make comments or have questions for the police ahead of time, that they can certainly reach out to, I believe which one was it? Nick Sanford?
Oh, yes, Nick Sanford and
Joseph Hopkins.
yes, those are the two.
Right.
Yeah.
So either of those two could be reached for comments ahead of time.
Yes,
And
exactly.
Carl, maybe we can arrange for you to send a reminder to everyone to pose questions to them ahead of time.
Okay. Okay, we'll move on then in terms of standing reports from social services. Well, we've been meeting about this coalition and stuff, and are there other things to report from social services?
Helen, do you want to report or you want me to do the report?
This is Helen Rubino Turco. The first item that we wanted to share with you was information about a hoarding task force. We hosted a regional task force, not hoarding, panhandling. Sorry, I know that Kelly's going to talk about hoarding perhaps in a few minutes. A regional panhandling task force that we roundtable that we hosted. Okay, let me restart. A regional roundtable on panhandling that we hosted in July. And we had over 20 participants from a variety of backgrounds to discuss this. And we talk about this in through the lens of prevention and mental health. And one of the people who was in attendance was from CROG, the Capital Region Council of Governments, and they have agreed to host a follow-up meeting that will take place in either October or November. And again, that's discussing this on a regional basis. We had members from community court, from police departments, from social services, from agencies that work in the field. And it was, and as well as corporation counsel, you know, so we had legal people. It was very well rounded and a very positive participation from the members that were there. So I look forward to reporting on what happens at the after the next meeting in either October or November. Astrid or Kelly, did you have items to add?
Thank you, Helen.
This is Astrid Calderon, Manager of Social Services. For the last 3-4 years, the town of West Hartford created a multidisciplinary task force called the Hoarding Task Force. This group is a combination of multiple departments, including the Department of Health, Building, Police, Fire, Social Services, and Zoning and Planning. We started this type of initiative because through many experiences and working together, we realized that some of the people who are hoarding or have this disorder have been impacted or have been in touch with multiple, issues, and some of the departments have been working with them or trying to work with them. But when we do not communicate well, we will not be successful. For example, we have people in our community that are hoarding animals, and we have people with, right now we have a house that have like 30 cats or multiple dogs. So we decided that this is the best way to work together. So every month we meet, we discuss cases, we discuss actions as possible, keeping all the confidential information among ourselves, and trying to see what will be the best approach for each individual. If it's a senior, if there's anything that we can help to relieve these situations. And we have been successful doing that for a long time now. Karen Paquette is the leader of that group. With that in mind, we created a support group based on a book that one of the doctors from the Institute of Living have wrote, and we have the only actual support group for hoarders in town. So we have been facilitating that group with multiple sessions. At this time, the group is free. A lot of other towns have been trying to reach and participate, and it has been very successful. We have been able to maintain people connected with substance abuse helpers, with people who can help in the community, support each other one every week at a time. As Helen mentioned, the panhandler situation, it had been very not, it had been noticed by many people, but we are, beside all the organization and trying to put together a regional approach, we also have been actively trying to work with the police about, some of the calls that we do receive, trying to help some of them. But also next Monday, we're going to have another social worker that will join our team, and that she will be the police liaison social worker. This position is based on the police reform and also based on the needs that we have in our community. So with that in mind, we're trying to continue to meet the needs of the community within each gap that we might have. So we are involved in many projects, as you might know, but this is all more related to prevention, mental health, substance abuse. Kelly and Jackie, did you wanted to add something to that? Any questions for me? Thank you.
Okay. Thank you, Astrid, for that report. I did have a question, but it's not necessarily for tonight. I think I mentioned it in a conversation with Helen as to what impact, if any, you may have observed from the new legislation that changed SNAP benefits and money to address poverty in America. And has that had any impact from your perspectives in social services in West Hartford and or the food bank? So you would know who to ask about that, but if we could hear a little bit about that, I'd have an interest in that.
We can report more, not only the food, but also, as you know, that the eviction moratorium was over back in August. So that's one of the biggest tickets that we have. In fact, tomorrow we have another eviction. Evictions are going to start, or started already. And between the food, electricity, gas for the winter, and paying the rent, there have been multiple issues after COVID, and also very diverse resources that people need to have access. So we are constantly reaching, what is it? How can we have the people connected with the resources? So I can do a report later on.
That'd be helpful. Thank you, Astrid. If there are no questions, we can move on to the West Hartford Bloomfield Health Department. I don't know if that will be Helen or Megan, or I don't see Helen.
That should be Helen, but I'm not sure where
She's
she
not
went.
at her desk.
Prepared for today.
So why don't we go to police, which I don't think there's anybody here from the police department either. Oh, here's Helen. Just in time, Helen.
Excuse me, this is Helen to help. I had to talk to a coworker who's leaving now, so I apologize for stepping away for a minute. I'll put myself on mute again.
No, actually, it was the time where we were asking about what's going on with the West Hartford Bloomfield Health District.
Okay, so for a quick Cliff Note version, we just finished, as you know, with all the COVID vaccinations, and we thought in June we were going to lay it down for a while. Guess what? Ain't going to happen. So we are now starting to do third doses, which is the recommendation from the CDC, and there's a strict criteria for that. So we are following that and doing our best to sort of have special clinics, and so that we can have a group of people so we don't have to waste any of the vaccine. That being said, we are now waiting for the CDC and the ACIP to have their meetings and to make their decisions about the booster doses. Let me explain between the two.
I'm sorry, Helen, could you lower your mask if you're in a safe place?
I was talking to somebody. I apologize. I was just talking to somebody.
Thank you.
I try to follow protocol. So the difference between third dose and booster. Third dose is for certain individuals with certain immunocompromised disease and conditions. Those are the people right now who are able to get the vaccine, and The difference is they can get the third dose 28 days after their second dose. So that's already in process and happening now. What we're waiting for is the ACIP and the CDC to make the decisions about the booster. And the booster is actually an extra dose of the vaccine. And those, once that booster vaccine protocol becomes official and we do the standing orders, we will start doing clinics, putting that out. And so that's the most important thing that people have to realize, that, we're just waiting. We know about it. And I'm going to see if we can talk to some of the people in the media and Renee, because I know people are calling us about it. And we just have to wait for all the pieces to get in together. I'm actually already starting to line up rooms to do major clinics if we need it. But we have to wait from the CDC and for the ACIP to make it official. Then we get the standing orders. Then we get our vaccine. So we are aware of it and watching it and making plans when it gets all approved. Right now, we are going to be starting doing the flu shots. And so we're going to start that in September to get all the Board of Ed done. So in the event that we have to do the boosters, I want to make sure our calendars are nice and clear. So I'm going to be doing flu shots the month of September, and I'm doing the rest of them in October, and then I'm done, hopefully. And then if we need to, we'll do the booster shots starting from that on. So that's
Great.
a lot in a nutshell.
I'm sure that's been a lot of work, Ellen, for sure.
Well, it
Yes.
certainly has.
Ellen.
This is Helen Rubino Turco from Social Services. I wondered if you have a date for the drug take back day that with the police department. Is that in October? Do you have the date of that?
Yes, we are already we are already on that, planning it, and we're actually, I was talking to Renee today about doing the drug take back is twice a year. It is in October and April. That's how it works. So we had the sign officially made, the banner from this committee. And what happened was they actually changed the address now. We are now going to be doing it at the Charter Oak School, because it really is a much easier site to use, and it's more on the beaten path than where we were in Brixton Road. That being said, we will have to make some adjustments to the banner, but I am actually, the biggest problem that I found last year, and again, that's why it takes a lot of people to get this done, because the police don't do a lot of advertising, and I get it. They don't have the time, they don't have the wherewithal to do it. So I am working with, we need to reach out to WEHA and talk to that Ronnie, because first of all, I'm going to be a little selfish. I want to make sure that it is said that it's sponsored by the West Hartford Bloomfield Health District. I've been doing this program for a long time, and I do want to take kudos for this. So I think it's important that our name gets on it, because we have done a lot of the background for this, and it's an important program. And one of the things that we're going to be doing, that Astrid had given us, are little packages that she has received over the last year. And so we will pass them out. They're little bags that people can use to get rid of their own medication and not wait the 6 months to do it. And so it'll be a responsible way to get rid of extra medication. So the take back date this year is October 23rd, and it's from 10 to 2. And that's going to be at the Charter Oak School, and that's on Flatbush Avenue. And then the next time it occurs will be in April of 2022. So I need to find the best way to get out this information. Thank you.
Thank you, Helen. Okay. Police.
This is Astrid Carr. This is Astrid Calderon. Can I add something?
Sure.
In addition to the Take Back Day, and in addition to the charcoal bags that the Department of Health through Helen Drohan that have been distributed to teachers, to a lot of adults, we have more of those charcoal bags that can carry up to 90 pills. And a lot of liquid and medications that can be disposed. But also, we created a long time ago a brochure that we need to continue with this prevention effort. we do have the drop box at the police station that we have to continue to promote, that it's open every single day, for people to do that. Beside those 2 dates, there's going to be the charcoal bags that continue to do that, and a lot of education. So I just wanted to, in fact, uh, publicly appreciate your efforts, Helen, by not letting this go. We have right now a few people that committed, accidentally overdose, and they are not with us. Some of them are, actually in town. I received notification that this happened. So we need to continue to monitor that as well and to promote it. So thank you, Helen.
Okay. Thank you. WHPS.
Do we have a report from the Board of Ed, from Melissa or Tor Fisk? Any report from things that are going on in the schools? Melissa?
Hi, everyone. Thank you for all that you're doing. I just wanted to let you know we did the mental wellness workshop that was led by Rosina Haskins, which was well attended. People were able to send in questions, and then that will be for anyone that registered. It will be sent out after as well. We're looking at, restorative practices for students that are, using terms that they shouldn't be doing rather than kind of disciplinary measures. But anyone who's using terms or needs, certain supports and help, Hall High School is happy because we now have 4 social workers for mental, support and students that are having invisible struggles and obstacles. We now added a social worker here, as well as under the ESSER funds, also another special education teacher who's also certified in English, that's able to help with students that just need another place or a mental break or getting away from the mainstream, someone that's there and supportive in a classroom as well for them to go. So we look forward to everything that we can do to help the students, because I am seeing just in my position a high increased need with parents that have reached out concerned about, especially over Labor Day weekend, talking to 3 parents whose students, unfortunately, their children had to go to CCMC, and just the wait time that they experienced and the help and the support that they're looking at the school to provide and the collaborative care with the outside physicians. So that's right in front of my face for the last 2 days. So I think that this group is more important than ever to be able to kind of figure out ways to support these kids.
Well, thank you, Melissa. We look forward to your input or suggestions or ways in which we may be helpful. That collaboration, I think, is why we're here.
This is Ari Steinberg from Board of Ed. I just wanted to let people know that we are having our first meeting tonight at 7 p.m. at Town Hall. I think we were originally scheduled for our first meeting the 21st of September, but given that school has already been in session, we decided to add an earlier Board of Ed meeting. So tonight at 7 o'clock will be the first Board of Ed meeting.
Oh, okay. Thank you, Ari.
This is Helen Rubino Turco. Melissa, I just had a quick question. Could you just talk a little bit more about the program that Rosina Haskins did on the mental wellness?
So one of the clinicians that's in town, who is actually one of the assistant principal's husband, was on there for a panel. We had 2 representatives, one from Conard and one from Hall High School, who were there. One of those representatives is a student who won a big contest and scholarship over the Summer for Champions conference, which he focused on stigmas in mental health. And then we also had Melanie Thomas, who is our new department supervisor for school counseling, on the panel as well. Rosina worked as kind of the facilitator, and it was kind of a panel of different stakeholders together, so people could put questions into the panel ahead of time And then they recorded it so that anyone that's interested, that registered would be able to get the link afterwards and watch it at their own time.
Okay, thank you,
Thank
Melissa.
you.
I have just a quick question. This is Helen from the West Hartford Bloomfield Health
Yes.
District. Is it possible that we could look at that link, Melissa?
Yeah, I could reach out to Rosina for it.
Appreciate it, because I mean, I know a lot of the panelists that you were talking about, but I didn't get to go to the meeting, and I really would like to actually view with that, if that's possible. Thank you.
Okay, great. Okay, Youth Services Bureau.
Hey, everybody. It's Chris Dutton here from The Bridge, Clinical Director of Community and School Services. And The Bridge is the Youth Service Bureau for West Hartford, so I'm here to talk a little bit about that. We don't have any special programs happening right this minute to talk about, but we have a bunch of stuff that will be coming up and that will be sort of formulating as needs arise over the course of the school year. But so, just a quick update on the summertime. We did our typical summer programming. We had mentoring programs, positive youth development programs. One of the big things that we did this summer was to help to expand some of the community gardens at Elmwood Community Center that the Teen Center Leadership Group had put together a couple of years ago. And we built some gardens at, I believe it was 2 schools. I'm going to have to defer to John to clarify the exact schools that we were at. I believe we were at Smith, but I think there was one other as well. That is preventative in nature because it gave the teens things to do, but it also helped to teach them some real life skills for the future. The big news right now is obviously the school year has just started. We'll continue to offer our mentoring programs, our in-school counseling programs, and our teen center. We'll be working with the schools to formulate groups specifically around the needs that come up around prevention issues, transition back to school, especially for kids coming out of remote learning. I'm hearing lots and lots and lots of worry about serious anxiety and serious social issues as kids sort of come back together and try to navigate, being in more typical type school settings as they've been away from those over time. The other thing that I just wanted to mention in this group, because I think it's really important, and I don't have any hard data on this information, but anecdotally, from the end of the school year and over the summer, and John, you could speak to this a little bit if you want, because this is really coming from you, but the teens that John was working with over the summer seemed to be describing an uptick or reemergence of alcohol use among teens. It hasn't really been on our radar in this group. We've really focused on vaping and cannabis use and, with legalization, of course, that's really on everybody's mind. Since I've been in this role, alcohol has been sort of just not on the forefront, but from the sounds of things, it's either reemerging or just coming back to our attention, perhaps. But stories of, big parties kind of in the area behind Shake Shack and, one of the kids that one of my therapists worked with over the summer kind of got caught with a lot of alcohol that he had, been supplying to some others. And, I don't know exactly where he was getting that from, but it's something that I wanted to bring up in this group because I think we should make sure we keep that on our radar as well, because, it's an issue and it's a big issue and it's a dangerous issue. And I just want to make sure that we don't lose sight of it.
Thank you, Chris.
Melissa, you mentioned, your worries about, the school year and how things are going. Please reach out. We haven't done a lot of groups at the high school level, but we can, and we can be creative about how to do it, whether it's after school hours or, rotating time, something like that. But we can come up with some things to make that work.
No, I appreciate it. And the students are excited to be back. We have everyone here. We did an open campus for the first time this year so that students, I think just by opening the school when it's empty during the summer and giving students the ability to step into a building when they don't have to feign knowing where they're going because there's other eyes watching, We were not expecting the turnout. We had 150 people show up for those 2 open campus. And the thing that melted my heart was it was a lot of older siblings bringing their younger siblings here and cheering on all of the 9th graders. So there really is a positive vibe and everyone's excited to be back. I have the unfortunate role of seeing some of the bigger kind of deeper things going on with the social workers that Chris, I know you work really close with. And I also want to just mention that Miss Oliviera from the Bridge Family Center was also part of that panel last night.
Okay, thank you. Sounds really positive. And Chris, I just wanted to identify that alcohol was the substance abuse issue of greatest concern per the wellness assessment, followed by prescription drug abuse and tobacco and cigarettes.
Wow.
So
wait, on that, the marijuana didn't even hit the radar on that?
Not as a major issue. It came down further along.
Okay. I mean, because it comes up in our groups and our therapy and whatnot all the time, of course.
Yeah.
But I'm not surprised to hear that alcohol was at the top of that right now. So
Yeah, I'm not either. Okay, thank you for bringing that up. Starting next month, we'll have a coalition report added here as one of the standing reports. The West Hartford Prevention Partnership that Astrid talked about. We'll go to the public comment section of the meeting, but it's new to my understanding that the meetings are posted on YouTube. Did one of you know about that? Because I saw that and I wasn't sure.
As we speak.
Okay. I'm sorry, what did you say, Andrea?
It's streaming live on YouTube as we have the meeting.
Oh, okay. All right. So we still have the public comment section, right? Okay. Do we have any calls?
No.
Okay, well, that sounds like a good thing. And next month, we're hoping to have a live meeting, perhaps in room 400 at Town Hall. Helen?
Yes, that's correct. This is Helen Rubino Turco, and in discussions with the town clerk's office, we are encouraged to meet in person. But we do need everyone to wear a mask, and so we have been able to secure room 400, which is a large room in Town Hall. So our meeting in October, barring anything unforeseen, will be in person. Yahoo! On Thursday, October 14th from 5 to 6.
Yes. Okay.
And just as a follow-up, Astrid had mentioned the Unite CT bus, so I'm just going to email everybody information about this program, which is for, it assists residents and landlords with rental and utility payment assistance. Sometimes people are really stressed out about trying to figure out what to spend their little, if they're challenged financially, where to spend their money. And this is just a wonderful program because on the bus they have computers and they have people to help people actually register for this program. And so it is going to be in West Hartford Town Hall on October 1st. I'll just send everyone the information.
Thank you. Thank you. Well, can we have a motion for adjournment from a council member?
So moved, Bob Macca.
Bob Macca. All in favor say aye.
Aye. Aye.
All opposed? Okay, we're adjourned. Have a lovely week, all.
Thank you, everybody.
Thanks for coming.
Bye.
Bye.